Hi there, I'm Becky McQueen, and I've chosen to research the professional practice model for Carilion Clinic, an integrated healthcare organization in and around Roanoke, Virginia. It is comprised of 7 hospitals that range in size from a 25-bed critical access hospital to the 703-bed academic medical center where I work. I'm proud to say that I am an ICU nurse for their Trauma One hospital, Carilion Roanoke Memorial, which has been ranked the third best hospital in the state of Virginia and in the top 1% nationwide by the U.S. News and World Report. As an organization, Carilion Clinic employs over 13,000 employees, representing more than 76 specialties in 241 practice sites with over 1,000 licensed beds and offers a wide spectrum of care, including urgent care, home health, retail pharmacies, and wellness centers. As a not for profit organization, Carilion Clinic takes its role in serving the community seriously, even listing it as the first of the company's core values, being community, courage, commitment, compassion, and curiosity. REACH, Carilion Clinic's professional practice model, that was originally developed by a group of its nurses in 2006, focuses on the nurses' relationships with patients and families, colleagues, and self, with the mission to improve the health and well being of the communities being served. It is centered around the patient, family, and community and has an overarching goal to promote population health, healthy communities, and excellent patient outcomes. Through Carilion's professional practice model, nurses are highly prioritized and greatly empowered to fulfill their mission of improving their patients' health and wellness through the professional advancement, professional shared governance, and advocacy in legislation programs, and through the required inclusion of nurses as voting members of governing bodies and organizational committees. REACH is an acronym where each letter of its name represents a core professional value and its definition. The R stands for research, commit to clinical excellence through inquiry and evidence-based practice. The E is for education, educate to elevate standards of practice and professional growth and development. The A is for advocacy, advocate for those we serve through interprofessional collaboration. The C is for clinical practice, provide safe, high-quality, patient-centered care. And the H is for human touch, connect with patients, colleagues, and communities with compassion and respect. REACH is an original professional practice model grounded in nursing theory, including Watson's theory of caring, Swanson's caring processes, Leininger's theory of culture care, and Dingman's caring model. It was adapted from the relation-based care model, which emphasizes the human aspect of care and the relationships that surround the patient as outlined through its 7 principles: caring and healing environment, teamwork, leadership, professional nursing practice, continuity of care, resource-driven practice, and outcomes measurement. As one of Carilion's nurses, I'm proud and grateful for the REACH professional practice model. I can feel its effect throughout the hospital as the focus on collaboration creates an overall atmosphere of respect. The model regards nurses as highly valued members of the healthcare team and clearly emphasizes the importance of nurses' contributions to patient care. Nurses are encouraged to take an active role in research, with many of their nurses being professionally published. They can continue their education and dedicate themselves to driving positive improvement in the healthcare system by creating partnerships with patients and families to establish goals and plans for delivery of patient-centered care. While I think Carilion's professional practice model is overall clearly written and does a great job of laying out their values and driving forces, I did find some of the verbiage to be lofty and vague and lacking particulars on how to fully implement its ideals and integrate them into daily practice. For example, I easily found how highly regarded nurses are by the organization, but I struggled to find detailed ways in which I could participate. Also, according to REACH, a major part of the nurse's role is collaboration, yet the model lacks information on the ways that collaboration should be incorporated into practice and how it should take place. Despite having a dedicated web page, I found it to be difficult to find certain specifics of REACH. Sometimes I even had to click on obscure looking links and sift through multiple pages before I found the information I sought. Carilion is obviously and understandably proud of REACH, and they should make its message apparent and accessible. While I believe this professional practice model to be beneficial and positive for staff and patients alike, it would only stand to gain in participation and influence with better promotion to individuals throughout the organization. I hope you enjoyed learning about Carilion Clinic's professional practice model, as I've enjoyed being able to find out about it and share it with you. All right, thank you.